Thanks, Mike, for the kind introduction. Yeah, and I apologize. My colleague, Dr. Brynn Dredla, texted me last night. The fortunate thing, though, is I helped work with her on these slides leading up to a year ago, and it actually centers around a publication we had together, and one I think that fits beautifully into convergence neuroscience between machines and human brains. And so I'll be looking directly at our machine learning IT folks as well as the psychiatrists, neurologists, and neurosurgeons. I have no disclosures with related to this topic. And so what is the problem, right? Why is cognitive bias a problem? And what this short TED-like talk is going to focus on is that you're going to see that cognitive biases permeate the entire human civilization and history. And with regard to the field of medicine and surgery, medical errors are perhaps a measurable area that either diagnostic inaccuracy or those type of cognitive processes are in the newspapers and of great concern, especially to the lay public. And so we don't have time to go into the cognitive bias codex, and this is a big sort of big visual about all the things that the human brain is prone to error, and you can see in the 4 different quadrants in terms of caching memory in the upper left, either not having enough information or being selected in the information that you're making decisions on can lead to error. In the upper right, this is cognitive overloading, and I would suggest in medicine this is a big problem where you can be information overloaded, or you have you make an anchoring decision problem. And in the bottom, you see there's not enough meaning or context, and then the bottom left, you don't either have enough time. But to simplify this, and it gets into the nature of the talk, as folks know that attended last year, the term convergence comes from the National Academies of Science, Engineering, and Medicine. They had almost 15 years ago this epitaph or monograph rather about human errors, and I think that you will be able to break these down into different categories, and I'm going to simplify it by showing you, I think, how Kahneman has it in terms of